Time for a visit with Dr. Kevin Kavanagh. Dr. Kavanagh, Dr. K as we call him, is a retired physician who is also the founder and president of Health Watch USA. Hey, good morning, Doc.
Good morning, Jack.
How are you this morning?
Oh, we're very good. Very good.
All right, well, the governor of New York, Mr. Cuomo, is doing a lot of bragging. Have you noticed over the weekend?
Well, I have, yes.
Is that well-founded bragging?
Well, I think he did a good response, but I'll tell you, with any of these pandemics, it's a team response from many different levels of government and many different people that are responsible for a good outcome. And New York does have a good outcome. And of course, they've been very strict with implementing public health guidance.
And they say they're ready to go back to school. And do you agree with the level of coronavirus that they have in their state, that would be appropriate?
I think that with certain guidelines, they could possibly try to open up safer. And I said safer, not safely. One of the problems that New York has is that their schools and their buildings, not all of them are very healthy. In other words, they don't circulate air well, can't open up windows, things like this that you become very concerned about, with spreading infectious diseases. Even the common flu, that is a problem. So we need to get our schools upgraded also. It's not just getting the virus down in the community. But certainly New York is probably in one of the best positions to try to open up schools, which is unlike Georgia, that, as you know, opened up during the height of the pandemic. They had the picture which was taken of people in the hallways. And the last I've heard, that one school has now had to reclose a couple of days because of an outbreak.
Well, tell us what happened over the weekend. Anything over the weekend that's new that we ought to be aware of?
Well, the best thing I saw, which I thought was very interesting, was that if you're running or cycling and you're downwind, you've got to be further away than 6 feet. And that just sort of makes sense. Yeah. The 6-foot rule is kind of a time rule, too, how far it takes those droplets to travel till they drop to the ground. So if someone is really riding a bike at a fast pace and you're downwind, it's probably 65 feet. Of course, if you're upwind to that person coming behind you and you're going away from him at that speed, you probably could maybe be closer than 6 feet. So this is strictly a speed phenomenon. Likewise, they said walking, 16 feet. But if you stay upwind from the person, in other words, if you've got a crosswind and you're just a little to the side upwind, then you're probably safer. So a lot of this, you kind of have to, it's not really worked out in real life, just in the lab. And of course, you also have the variables of, well, the virus is becoming diluted, it's outside, the sun's out. So who knows? But nevertheless, if you're downwind from someone who's cycling and you're cycling, you need to put greater distance between you and that person. You don't want to be riding in their vortex.
I saw or heard, I can't remember which, a headline that indicated that over the weekend, Dr. Fauci, who of course we had on with us last week, was indicating some negativity about the vaccine, saying that it may not be as effective as we think. Now, is that true? Have you heard that?
I haven't heard that. You just can't tell. There are a lot of things people are now starting to say and realize about this virus that I think the vaccine's going to have to go through some very rigorous safety protocols also. And that's concerning because, as we've talked early on, this virus, it affects your immunity. The older people tend to die more than the younger people with this. And it's not because they're weaker individuals. Yes, that's a factor. Their immunity isn't as great in some cases, but in other cases, they have a hyperimmune response to the virus, which to me indicates it may be some residual immunity that they have to another coronavirus or another exposure somehow. And so that's very unusual with this type of a virus. If you look at the flu, the main group that dies, the age group, is the younger people, 20 to 30. So this is kind of flipped. So I think that warrants some caution. And a lot of that has to do with T cells, and they'll talk about whether they're beneficial, whether they're harmful. They still don't know, and I think we'll be hearing more and more about that in the future.
Yeah, tell me a little more about those T cells, not to get into too specific, but what does that mean?
Well, there's two types of cells. Back when I was in training, there were B cells and T cells. B cells produced antibodies. T cells at that time were thought to just be killer cells, kind of like hand grenades. They would go in and blow everything up, including your cells, viral cells, invaders, whatever. Now we know that there's helper T cells that help the B cells make antibodies. There's memory T cells that store the memory of the immune response. And there's also still killer T cells. So in essence, it's good to have the antibody T cells. If you have a few killer T cells for hard to locate infections for you to get out and remove, that's probably good too. But you don't want to get into what's called a hyperimmune response, where your immunity starts to react against your body more than the virus. And that's what happens in older individuals. So safety is very important with these vaccines. And not only that, but we're going to be learning more and more about this. On the two articles which have come out on this residual immunity that they're picking up in communities, in other words, this T cell immunity to the virus that they're finding, the articles are very positive, but there'll also still be a caveat in them. Well, one person will say, well, we don't know for sure. They could be somewhat harmful, or maybe they're beneficial. So who knows? We're still learning about this virus. And believe me, the people that are making vaccines and treatments are all over this. They're fully aware of it. They're testing for it. They're monitoring for it. But that's one of the reasons why we're going to have to follow things very closely and look at both vaccine development and any treatments that we have. And if you can remember, one of our most effective treatments is dexamethasone, and that's an immunosuppressant. And that, in some cases, can cause a 60% reduction in fatalities. And that, again, is turning off your immune response or lowering your immune response so it doesn't become hyperreactive. Now, the timing of that's key, because if you gave it on the front end and you didn't get any immune response, then it could be detrimental. So a lot of these things with this virus and a lot of these treatments have to do with timing and making sure what you're doing is augmenting a supplement or a beneficial immune response in the person. So this is going to be, I think, pretty complicated, but also interesting in the future.
All right. Thank you, Dr. Kevin Kavanagh. Thank you very much.
Thank you now.
All right. Thank you, Dr. Kevin Kavanagh. Thank you very much.